On today's Wellness with Wood, we're talking about Black Breastfeeding Week. That's going on right now. And we're happy to be joined by Margaret Brown, who is the Senior Director of Care Management at Priority Health. Margaret, thank you for doing this. And let's begin with how and why was Black Breastfeeding Week created?
Thanks for the question, Rick, and thanks for having me. So Black Breastfeeding Week, it's actually occurring right now in August, which is part of Breastfeeding Month. So a national recognition for this exquisite and very important practice. Black Breastfeeding Week is all this week, and it really was created to shine a light on the unique challenges that Black families can face when they are breastfeeding. I don't think many people are fully aware of some of the historic and cultural barriers that have existed along the way, wherein Black families will oftentimes have a lack of representation and support, and it can make breastfeeding much more difficult. So today is really an opportunity to acknowledge those disparities and acknowledge the unique challenges and ensure that Black families are getting equitable access to breastfeeding resources and education.
Yeah, I think that's very interesting because I think you're right. People don't probably know or understand, but in some of the information that you sent us, the CDC data, there's a significant gap in breastfeeding rates between Black and white infants. And you told us some of the reasons, but what are some of those roadblocks? What are some of those holdups for women perhaps who would like to be breastfeeding but can't quite do it?
Yeah, it's a great question, Rick. So yeah, there are multiple factors, quite honestly. And so sometimes it's really just a lack of cultural awareness and really having an acceptance of breastfeeding in the community. There might be even fewer role models that women can, that they can rely on or even find or even connect with that may make the incidence of breastfeeding a lot lower in the community. There's also oftentimes misinformation or negative experiences that people have had in the Black community with healthcare systems overall. So that can contribute to some of those barriers and some of the reasons why we also see the disparities that we do. And last but not least, it's really like a combination of social and economic barriers that we face. And so when you combine all of that together, there are multiple reasons why this has been such an issue in the Black community.
Yeah, one of the things we've talked about extensively here is that relationship with a primary care physician to help you navigate through some of these things. If you don't have that, that's one more place where you don't get the support that you need. But
absolutely.
But it's really important to recognize the health benefits. And when you talk about people who may be socioeconomically challenged, as you were just talking about, breastfeeding can really be a benefit for the child.
Absolutely. It can be a benefit for the child and for the mother, and actually be a bit of a benefit for the pocketbook as well. So there are multiple benefits. So let's talk about the babies first. So for babies, we're really looking at how breastfeeding can help to boost their immunity. It helps with brain development, and it also helps with the incidence of asthma or type 2 diabetes later in life. And breastfeeding is also very helpful for the mothers as well. It can help to reduce breast cancer and ovarian cancer, also help to decrease type 2 diabetes as well, and heart disease for mothers who are breastfeeding. And just a small correction there, Rick, I believe I said for babies, we're also looking at the lowering the incidence of type 2 diabetes. It's more so obesity in babies that we're looking to lower when moms are breastfeeding.
Real quickly, we're almost out of time. If you just had 10 seconds to tell somebody an expectant mother who wants to breastfeed but doesn't have the resources, what can they do?
Absolutely. So I would encourage people to go to priority.com. We have a plethora of resources that are available right here in the community, and then also use some of your other online communities to connect with people as well.
Margaret Brown, thank you so much for being here.
Thank you.